more difficult for your baby to latch, so it's good to massage your breast from the outside toward the nipple before feeding. And a nice warm shower may also help, and you've definitely earned it. Mastitis is a bacterial infection that can develop when breasts are not drained enough. Symptoms include swelling and pain in the breast, as well as fever and aches. It only affects about 3% of breastfeeding mothers, but it requires medical attention and antibiotics. If you have these symptoms, contact your provider and continue feeding your baby. The infection will not affect your milk. You can use a breast pump or the techniques for engorgement for relief. If you feel soreness and a lump in one breast, you may have a blocked or clogged milk duct. This can happen when your baby doesn't fully drain your breast, or the feeding schedule changes, or your milk ducts are compressed by tight clothes or a seatbelt. This is pretty common, but don't worry. Here's what you can do. Continue to feed your baby. In fact, offer the clogged breast first. A warm compress and breast massage before the feeding will also help get your milk moving. Thrush is a fungal infection on nipples or in the breast that causes sore nipples, achy breasts, and white spots on baby's tongue or the inside of their mouth. If you have these symptoms, you'll need to get treatment from your provider for both you and baby. It is easy to pass this infection back and forth. Breastfeeding feels different for every woman. Your nipples may be sensitive and you may feel a little discomfort as your baby begins nursing. If your pain or discomfort is severe or lasts throughout the feeding session, talk to your provider about getting lactation support. Getting a good latch will make breastfeeding more comfortable and effective. If you feel pain after the first minute or so of latching, your baby may have an improper latch. Other signs include light, quick sucking, puckered cheeks, and no swallowing sounds. It's okay to break the latch by inserting your finger in baby's mouth and then try again. We've all been there. With enough practice, baby will learn to latch well. Some babies are born with a tongue tie, a shortened frenulum, the part that attaches your tongue to the bottom of your mouth. Babies with tongue ties may be unable to latch deeply, lose suction on the breast frequently, want to nurse constantly to get enough milk, or have poor weight gain. You can usually see that your baby's tongue is unable to lift or move freely. This can be resolved with a simple office procedure, so talk to your provider if you suspect this issue. The first few days of breastfeeding can be tough on your nipples. No one likes that. But don't worry, this discomfort usually lessens naturally as you get into the breastfeeding routine. To help, wash with warm water, but avoid soap, which can irritate broken skin. Allow breast milk to dry on your nipples after feeding. Use purified lanolin to soothe and heal if needed.
Just kind of going on there and like scrolling through and that really helped. And like I said, just getting like that basic support, because you need support, you know, especially from other moms that have been doing this or just kind of starting out too. Like there's different stages, and I think that at all stages you just need a little bit of support. So
it's really nice to know that you're not the only one that's going through it at the time.
yeah.
Yeah. I had several friends that had babies like right at the same time, and just talking with them and you know, hearing what worked for them, or just knowing that the end, you know, that there was an end in sight as far as like the soreness and things like that.
As a breastfeeding mom, I wondered about how what I was eating would affect my baby. Of course, a well-balanced diet of healthy foods is best for both mom and baby during breastfeeding. Sometimes, though, a baby might have a food sensitivity, a reaction to a food in the mother's diet. Reactions last less than 24 hours, and babies may cry or fuss after these foods. Common culprits are spicy, greasy, or gassy foods. You can avoid these foods in your diet if you notice a pattern. Babies are rarely allergic to human breast milk itself. Less than 3% of babies who are exclusively breastfed may have an allergic reaction, often to cow's milk in the mother's diet. This can cause severe colic, that's crying, signs of discomfort, skin rash, vomiting, diarrhea, or trouble breathing. If this happens, talk to your provider right away. Most babies do grow out of milk allergies, but they are serious and can be fatal. Recent studies show that early exposure to allergens like peanuts, milk, and eggs helps reduce the risk of allergy to that food. Likewise, it is not recommended that moms avoid allergens in their diets when breastfeeding or pregnant, even if they have a family history with food allergies. If your baby develops minor allergy symptoms, such as rash or diarrhea, then talk to your pediatrician. Mom can also explore elimination diets to find the culprit. If your baby has life-threatening reactions, breathing problems, swelling, hives, call 911 or get to an ER immediately. Oversupply is when your body makes more milk than your baby needs. It might sound like a good problem to have, but it can cause some challenges for both of you. Some signs of oversupply for your baby might be coughing, choking, or gulping, pulling on and off the breast, arching the back or stiffening, clamping on the nipple to slow the flow. With oversupply, your baby may fill up quickly at a feeding on foremilk and miss their chance to get the fattier, more filling hind milk. This might cause them to get hungry faster and want to feed more quickly. If this happens, you might also notice greenish or frothy stools. To treat oversupply, you can adjust your feeding pattern to slow down milk production. Try offering only one breast per feeding, but beware of engorgement. Your provider or lactation consultant might recommend block feeding or consuming herbs or foods that reduce milk supply as well. You might wonder if your body is making enough milk for your baby. I get it. We can't see how much they're getting. Rest assured, most women do make enough milk. To maintain your supply, be sure to get enough rest, or as much as baby will let you. And take care of yourself by staying well hydrated, eating healthy, balanced meals and snacks, and keeping your stress level as low as you can. Skin-to-skin contact and cuddling with your baby also helps. There are some factors that can cause low supply, including some oral birth control pills or other medications, fewer milk ducts due to surgery or cancer, supplementation with formula or bottled milk, drinking alcohol or smoking. There are a variety of strategies to increase milk production, so if you're concerned about low supply, talk to your provider for recommendations.
If you are having supply issues, meaning you're not making enough milk for the baby or you're making way too much, there are also ways to treat that as well. So talk to your provider or a lactation consultant.
Most babies get their first tooth around 6 months, and yikes, what if they bite? The good news is babies cannot bite while they're actively nursing. However, they may try biting at the nipple when they are sick, teething, or transitioning to bottle feeding. If it happens, break the latch and say no firmly. And remember, they don't know it hurts you. Babies need to eat often, so there will likely be a time you'll need to feed your baby while in public. First, know that breastfeeding in public is legal in all 50 states. Unfortunately, that doesn't mean you'll never encounter criticism. We've all seen those stories in the media. But recently, many public places have begun adapting to be more breastfeeding friendly. Some tips for breastfeeding in public. Wear clothes with easy access. Use a wrap or shawl to cover yourself and baby during the feeding. Definitely do try this at home first. If needed, find a women's lounge or dressing room for privacy. Returning to work can be a challenging transition for both mom and baby. To prepare, be sure you know about safely pumping, storing, and preparing breast milk in bottles, and practice all of this at home with your baby. You'll also want to talk to your employer as early as possible about a private area to pump and flexibility in your schedule. And when you're going back to work, plan ahead by packing everything you need, the pump and all its parts, snacks, a shawl, etc., the night before. The first few days can feel a little like juggling, but trust me, it does get easier.
Not being afraid to ask for help, because I feel like as moms we're like supposed to know exactly what to do, and like it's just supposed to like, you know, mom
How
grouping and stuff,
natural
it's supposed to look so easy and all those things. But sometimes
would always suggest supplementing too. And I mean, it was harmful because I didn't do it, but that was kind of my way of suggesting that.
Although it might not be a piece of cake, breastfeeding your baby is worth it. And it's okay if you run into some of these issues. Now you know how to identify the early warning signs of breastfeeding issues, common problems and concerns, and most importantly, the appropriate next steps. Remember, getting support from your provider or lactation consultant can help you feel at ease as you establish breastfeeding with your baby. You've got this, Mom.